kick us off. Somebody must be on mute.
Well, we'd just like to welcome everyone to the meeting today. We have a nice agenda set up, great speakers and presenters, presenter tonight. And so we're just looking forward to the meeting. I hope everyone is well, and we're just glad to see all the faces.
And I'm going to go ahead and call on people to introduce themselves. And I will start with Judy. Oh, you're good. Oh, no, then you hit it and then hit it again. So now you're muted. Now you're good.
Sorry. I'm Judy Haddon, and I'm a community member of the partnership.
Michael Griffin.
I'm Michael Griffin, and I'm a community member, but also the partnership chair.
Kim Baldini. Kim, are you on mute? Or did you?
No, I'm here. I was trying to start. There we go. Hi. It's being out of work for 5 weeks. I can't even operate Zoom. I'm Kimberly Baldini, and I am the Youth Services Section Leader with Parks and Recreation.
Lynn?
Yes, hello everyone. I'm Lynn Ngay with VHS. I'm the Prevention Director. Thank you.
Erica?
Hello, I'm Erica Gibson. I'm the Child Care Services Supervisor with Child and Family Services.
Michael Brown?
Hi, I'm Michael Brown, community member of the partnership.
Alicia?
Hi, everyone. Alicia here. I'm a community member of the partnership and co-chair the Youth Mental Health and Wellness Committee.
Jamie?
Good evening, everyone. Jamie Premdas, she, her pronouns. I am the Children's Behavioral Health Bureau Chief.
Dave?
David Carlson. I'm a community member of the partnership.
Linda?
Linda Henderson, and I'm a former member of the partnership.
And current member of anything in particular?
Past member of the partnership.
Yeah, okay. Sally?
Hi, I'm Sally Labonte. I'm the web coordinator for the partnership, and I've been off for a while too, so it's nice to see you guys.
Siobhan?
Hi, everybody. I'm Siobhan Grayson, Youth Outreach for the partnership.
Rachel?
Hi, I'm Rachel Harlan, and I'm the representative from the libraries for the partnership. And just as a note, I'll be this for two more months. I'm retiring in April.
Congratulations. We'll miss you. Tabitha?
Good evening, everyone. Tabitha Kelly, she, her, hers, Child and Family Services Division Chief.
Rick?
Hello, I'm Rick Strobach. I work with the Juvenile Court.
Ann Vorderbrugge?
Hi, I'm Ann Vorderbrugge. I'm an emeritus member myself, and on the Youth Mental Health Committee.
Jeanette?
Hi, I'm Jeanette. Can you hear me?
Yep.
Okay, hi, sorry. Hi, I'm Jeanette Allen. I'm the Interim Assistant Superintendent of Administrative Services with Arlington Public Schools.
Thank you. So glad you're here. John?
John Andelin. I'm a member of the partnership and also on the board of the Community Foundation.
Megan?
Hi, Megan Mack, community member and current vice chair of the partnership.
Ann O'Brien?
Hi, I'm Ann O'Brien, community member.
Lisa?
Hi, I'm Lisa Kaplowitz, Division of Public Health. Sorry, I just got home, so trying to do 10 things at once.
That is perfectly fine. We appreciate you getting on. Ben?
Hi, I'm Ben, community member.
I think I got everybody's name. Deirdre, Dee, I'm going to introduce you in a minute, but I think that was everybody. Did I miss anyone? Oh, Kim.
Kim DeBlau, community member and co-chair of the Youth Mental Health and Wellness Committee.
Okay.
And Kim, I think everybody knows me, but just in case, Lori, Arlington Public Schools, Director of Student Services.
No, thank you. That's what I was looking. I was like, I was trying to write everybody's name down while admitting them. So I obviously missed a few folks. Well, thank you very much for joining us. I don't see Cristina on yet. She's our new school board liaison, and we look forward to welcoming her when she is able to join us. But in the meantime, we have Dedra Curteman, and she is with the Budget Advisory Committee. And if some of our members might remember, not this past September, but the September before, we had a really good conversation with a lot of the different advisory committees. And one of them that we had come and talk with us was the Budget Advisory Committee. And so it sort of started this, we should be meeting with them, particularly when we're looking at our advocacy plan and finding out what is going on with the schools and seeing where we can dovetail and how that might inform us. And if you looked at the agenda tonight, you might notice there's a little bit of an advocacy theme there. So we thought it would be wonderful to have Dedra join us. So I will turn it over to you, and she has time, a little bit of time for Q&A. So scribble down your questions. You can put them in the chat, or we'll have time to be able to just unmute and ask questions. So Dedra.
Thanks, Kim. Can everybody hear me okay? Yeah? Okay, good. I appreciate you inviting me to spend some time with you tonight. And I have to be honest with you, I actually I'm not familiar with this community group. And it's great just to watch how much involvement and overlap there is with the county and then APS and the community. What an excellent, excellent sort of representative view of so many people that have an impact on kids' lives. So thank you for your service on the committee. I'm just going to share a little bit with you tonight about what the Budget Advisory Committee is looking at this year. I too, like many of you, serve as a community representative. My husband and I have lived in Arlington for 17 years. I moved to Arlington directly after law school. I graduated from the University of North Carolina. And like all good things, I felt like my advocacy really didn't start until I had a kid in the school system. And then it just ramped up exponentially. So we had the wonderful pleasure of attending Key Elementary in Clarendon to use the Spanish immersion program, which is one that Arlington offers to many of our students through 4th grade, and then took a bit of a pivot this year. And we're now sending our 11-year-old to a local parochial school for a number of reasons. But it just made sense sort of in the context of the pandemic and his learning needs. So I remain very involved. Like I was sharing with Kim, much to his chagrin, he's always asking me, why are you still involved? What are you doing? We're done with APS. Because he had spent many years watching me spend a lot of time with the PTA. So thank you for your service, because I know that it takes a lot of long evenings and slogging through a lot, especially in these times when you're kind of done with Zoom anyway. So what I'm sharing with you tonight, I'm going to see, I have some slides that our co-chair had developed. So I'll ask him if they're shareable. And if they are, then I'll share them with Kim and she can just send them to the group. But I apologize if I'm looking down because that's what I'm looking at on my phone here, slides that I'm sort of sharing the content. So please don't think that I'm distracted. I'm just trying to impart some information. But I'd hope that this is sort of a beginning of a longer conversation, meaning that, you know, Dedra, I also go by Dedra, just doesn't show up for one meeting, but if you have, continuing concerns, questions, especially as we get into budget season, which really sort of kicks off in February, that you reach out to me directly. And Kim can share my contact information with me, because what the committee is trying to do this year is really involve the community more and our advisory groups more in shaping what the budget looks like, because the budget, it directly impacts all of our kids. So all the stuff that you do on this committee, has an effect on our kids, and is probably tied to some budget dollars. And so it's really important that we hear from everybody, because everybody's a stakeholder in this process. So unfortunately, even though you don't sit on the back, you get to still contribute. And I'd love to hear from you. The other sort of tidbit I'll share is when Cristina is able to join you, she served on the back for many years. So although she doesn't serve on the back anymore, she has a very good understanding of how the budget process works. So please, I don't want to speak for her, but I'm sure she would be more than willing to answer any questions you guys have. Okay, so I'll cut to the chase. We are in a precarious budget outlook situation this year. A lot of the numbers in terms of our ultimate deficit are changing on a daily basis. And that is because it's all tied to the amount of CARES Act funding that we either get from the federal sources or from state sources. So Leslie, who is our APS liaison and the assistant superintendent for budget, will tell us at every meeting that it's just a constantly changing situation. So I would hope when the superintendent's budget rolls out in February, we would have a better grip over how much money we're actually going to get from the feds and how much money we're going to get from the state. And hopefully, I'm kind of crossing my fingers that under a new administration, we continue to see more CARES Act funding to school systems, because it seems to me, just as an Arlington citizen, that if anything, the pandemic has really affected our kids a lot. So unfortunately, the downturn too is affected, caused by the pandemic, has resulted in significantly decreased revenue. And the school system is experiencing increased costs because of the pandemic. So last spring, the school board needed to make deep cuts in the FY 2021 budget. So they eliminated the staff compensation increases. They reduced minor construction / major construction funding, and they increased class size by 1. And that was at grades K through 12. And those changes were needed. So those changes were made. But in addition, we had to then dip into 17 million worth of reserve funds to balance the budget last year. So this year for FY 2022, which is what we're preparing for come February, we are looking at a 60+ million deficit. That can be reduced by in any number of ways. Similar to last year, when we dipped into the reserves by using 17 million, we could similarly do that this year. So there is the opportunity to reduce that deficit to from 37 to 44 million of a deficit if all of our reserves are used. But remember, reserves are, like all of our savings accounts, they're used for when we actually need it. So there's definitely a balancing of like, how much do we dip into those reserves versus making cuts in our budget this year just to continue and have something left in our reserves. So Arlington is not alone in this. From the national context, in the recession that started around 2008, K through 12 schools received 64 billion in federal aid. But even with that aid, the nation saw losses of about 120,000 K through 12 teaching jobs. And that more than a decade later, the United States still doesn't have that number of public school teachers today that it had in 2008. So revenue, which dropped about 8.6 during the Great Recession, is predicted to plummet as much as 15 to 30% this time. And so districts will need about 230 billion and up to 305 billion to stabilize their budgets and avoid massive layoffs. And I think that's a stark reality in trying to sort of of gauge the various needs that we have in our budget and looking at what we're going to cut versus what we're going to increase. Any questions thus far? I know that's a bleak look. So the school board came up with some budget direction last spring, and I'm just going to share some of those highlights with you so you know the direction that the BAC is taking thus far. But those direction items emphasize that the school board has 3 overarching goals: a focus on excellent education regardless of the delivery model, support staff to be innovative and deliver high quality virtual and in-person instruction, and a continuing focus on equity. In addition to those 3 highlights, they asked for us to continue to implement requirements in the English learners /DOJ settlement. I think we're in year 2 of that settlement agreement in order to meet the deadlines that are required by that settlement. Request that the superintendent work to find some sort of compensation increase for our employees in FY 2022, if at all possible, and then proceed with a compensation study with the goal of having recommendations to inform future compensation increases. So on that last item, I can tell you that the compensation study has been released. I'd be happy to share it with the group if you all would like a copy. If you want to reference it, though, I think it was shared in like the beginning of January at one of the school board meetings. I haven't had a full opportunity to digest it, but I think it has some useful information. That's all from summaries that have been provided to us. So that was like, those were the 3 overarching things. And then they asked us to, do additionally these other things. And then what they're saying is, if possible, they want us to also consider steps to continue to implement recommendations from the evaluations of services for students with special needs and English learners. Continue the implementation of the initiative to provide additional technical support center technicians to meet the standards of quality that began in the 2020 budget, and present a needs-based budget with options for reductions and repurposing of funds as needed that are focused on equitable strategic changes in delivery across the school division. We're also trying to present a transparent budget. So in the name of transparency, that's one of the reasons I'm here with you. And I'm kind of making the rounds of, Kim and I met at the Arlington, Teaching and Learning subgroup where I provided sort of a general overview. So in that vein, we want to provide details for any significant changes in any of in a major expenditure category. We want to explore possibilities for increases in revenue, including a review of all the APS fees. So think, when citizens use the pools, for example, at W&L, or go to Wakefield and use the pools, looking at those fees and setting up the fees in a way that actually support the funding of the facilities plus more, perhaps. And then consider reserve funds as needed for FY 2022. So that's a lot. And we're here to listen to you if you have ideas for potential cuts. Unfortunately, cuts are sort of what we're looking at. We've looked at some other ideas from other districts in terms of reducing expenses, just to throw out a couple, not saying we're committed to them, but looking at, again, the class size, looking at blended learning capabilities, especially since we've moved into an online format with a lot of schools, whether that can be somehow present an opportunity for potential savings in the future at certain levels within the school system. Looking at non-teaching professional learning days. Let's see, what else? Improved purchasing, just in terms of looking at just savings. Renegotiating existing contracts and looking at vendor pay cuts. I've heard this thrown out before. I don't think it's something we've really explored, but in terms of capital improvements, looking at public-private partnerships for school construction. And then, of course, the dreaded, increase, local property tax increase. I mean, it may just have to come to that. And again, I also talked to you about the federal aid and the state aid. So a lot of this is, of course, hinges on what comes from the CARES Act and the CARES funding. I think that's it from me.
So I'm sure there are lots of thoughts. Somebody want to raise their hand or unmute, or I don't know how my hand got up like that. Oh no, that's it. So anybody? This is not the time to be quiet.
I can't see where to raise my hand, but it's.
Oh, there you go. Go ahead, Ann.
So Dee Dee, the partnership, we're pretty broad in our areas that we address, but in general, they're around school readiness and success, and mental health issues. Youth mental health is a huge issue on our plate. And so, and then using data to engage parents in positive youth development. And so what we would be very interested in and what we have advocated for years using our data is more, not less, mental health supports in the schools around counselors and therapists and social workers, et cetera. So that is a really critical value to this group. So I don't know if you have anything to report on that.
I don't, though I do have a follow-up question, Anne. Are counselors, so social workers, I know there's like several sort of levels of social workers and counselors. Are those, I would have to do a deeper dive into this, so I'm just asking you if you know off the top of your head. Are those allocated right now based off of school populations, sort of like gifted and talented is based off of like you get 1 FTE for every 500?
Well,
kids?
that's been one of the hot topics, because what we have always said is that it's not a formula. Like certain schools have much higher needs, so it shouldn't be one of those planning factor decisions. But Laura Newton is on the call and she probably knows where they are with that.
Hello, everyone. Yes, we have always been short. Like right now, there is a ratio based on the state of how many counselors you have per school, right? So it's 1 counselor per 250 in the high schools. And I know that the state has also made changes for the elementary school. They make the proposal, but they have not been able to implement the ratio because of funding. So that is, has been passed by the state, and we just have to wait until funding is a little bit better to improve the ratio in the elementary schools. We follow the association's recommendations for counselors and social workers. But, having said that, there's never enough staff to cover the need. So right now, for example, just because of need, we have 2 psychologists and 2 social workers per high school, and 1 social worker and 1 psychology at each of the middle schools. Counselors, of course, they are assigned to their schools, but psychologists and social workers, we don't have enough to be 1 per school. So they are itinerant. So that means that some schools, some social workers and psychologists have to work in more than 1 building. So ideally, if we could get to have 1 social worker and 1 psychologist in each of the school, that would be the ideal. In previous years, the student advisory and also the partnership has helped us increase the number of psychologists and social workers, and that had been tremendous help to us. And so the last time that we proposed that, they told us, don't propose it anymore because we don't have the funding. But
Laura, when you use the term counselors, is that synonymous with psychologists, or is that in addition?
No. School counselors. And in addition to that, we have school psychologists and social workers.
Got it.
And we're also very fortunate to have substance abuse counselors, but we only have 7 of them. And then again, they have to share schools because you cannot have 1 substance counselor for each of the schools.
There's another question that's about what would be the pros and cons, and I'm not sure who has the answer to this, but the pros and cons of adding another student to the classes. So who's looking at that as a benefit to the budget?
So I can't say that anyone in specifically has been looking at that. It's just been floated as a general idea. Yeah. So, you know, gosh, there's so many pros and cons, probably more cons than pros. You know, I think it's interesting that last year they decided to increase class size at the K through 12 level. Because I think, I mean, again, I would have to sort of delve into it a little further. I think they get their, you know, the district gets the biggest bang for its buck, essentially, in the increasing class sizes in those age groups. But, you know, I think, at least from my personal standpoint, and again, this is a lot of Dee conversing with you all and your personal viewpoints. It seems like the district is going to have a lot to do after we come out of this online learning environment, especially from a readiness perspective, because a lot of our students are losing a lot of ground. And primarily, you know, students that were disadvantaged to begin with and, you know, are just continue to lose ground because of lack of resources.
Dedra, can I actually chime in on that? Hello, everybody. I apologize for the slight delay. I was triaging a little bit of a work crisis, but I'm Cristina Diaz-Torres. I'm one of your 2 new school board members. And I just want to chime in on that point particularly. The Department of Teaching and Learning is talking actively and playing out those pros and cons and making a determination and providing a recommendation to finance and operations as to where to make those cuts based on instruction. I think I echo a lot of the sentiments that Dedra just mentioned, that we are going to have a lot of needs coming in when students do come back in person, whenever that may be. And for many, it's going to vary in terms of event horizon. We know that a lot of families are not going to feel comfortable, even when a hybrid option is available, they will not feel yet comfortable sending their kids in person. So the first time that we might see students in person might not be until next school year, might be further out depending on the rates of transmission and where we are and those families, individual families' level of comfort. So the conversation is certainly being had at the board level and at the Department of Teaching and Learning level and at the finance and operations level, with a recognition that we are going to need more staff, not less. I cannot make any guarantees that we will actually be able to add the additional staff that we need, but we know that that is a very critical need, and we are going to try and address them as quickly as possible. I can say that given the conversations that are happening at the federal level, this is one of the areas where I think we will potentially see additional investment of federal dollars. Federal dollars comes with lots of restrictions. Whenever they send money to the school system, they send it with a nice list of things. You must use it for this reason. And thankfully, mental health supports and hiring those additional staff people that we need for these mental health supports will likely be among those reasons. And we're seeing a lot of conversation. If you're paying attention to the conversation on the Hill and negotiations that are happening right now, we're seeing that listed as one of those key approved uses. So I'm hopeful that we will be able to come up with a plan to triage our needs. And I know that the conversations are being had among the ELT and among the staff to figure out what are the pros and cons and what are the implications if we make a certain decision, what are the implications in other areas, and how do we best make sure that our budget is positioned to address those. So I just wanted to chime in on that particular point, but Dedra, I won't take the rest of your thunder.
No, and Cristina, I put in a word for you. I mean, on many levels before you joined us, but one that you have the back experience. So for many reasons, Cristina is very well equipped to be in the position she is. So congratulations, and please use her as a resource. Cristina, just to know, I think there were 2 separate questions. So one was, you know, we were sort of discussing whether how the allocation of psychologists and social workers, you know, and that's based off of the population versus looking at it from a needs-based perspective. So Anne was sharing with us, you know, that there are greater needs in some schools, and it should be more than just doing it based off of a planning factor.
Well, and that goes to the equity versus equality, you know,
absolutely.
And really making sure, and that, as Anne was saying, that is something that the partnership has always tried to support, is the equity across the system, not just, you know, everybody gets 1 or 1.5.
Absolutely. And then there was a question in the chat about what are the pros and cons of increasing class size. So I just want to make sure we were like, there's a couple of issues floating around. If I could just track back to Anne, and I hate to put you on the spot, Anne and Ken, what would you advocate for? What does the partnership advocate for in general in terms of if we were to look at a more equitable sort of assessment of needs? How would that be determined? Are we looking at, you know, the percentage of children using the free and reduced lunch program in certain schools? Are we looking at the number of English language learners? Like, what does that look like beyond if we were to move from a factor type of discussion to something else?
We have data that is collected. It's student reported data at the middle and high school level about their mental health. So students are reporting depressive symptoms or anxiety or things like that. And so we do have data that can help inform those decisions. And I know that Laura, that her office collects different data, and I know Jeanette probably has different data, but if we were able to put all of that together, and we are going to be hiring a data specialist who's going to be starting, I believe, on February 8th. But anyway, she can help with that because she's actually a school employee to sort of pull all of that together so that that can help inform some of the decisions about where those resources could be allocated. Now, we've just started looking at that data for 4th and 5th graders. It's a little bit harder at the elementary level, but we definitely have data and trend data for middle and high school students.
Great.
Now, just to add, as far as the elementary school, it's such a critical time to have, not just from the standpoint of intervention, but also prevention, to have mental health supports. And we, I think that, you know, the factors you listed, the free and reduced lunch and the English language learners, is a good proxy for need. I was for 9 years at Carlin Springs Elementary, and that community is an outlier in many ways. It's by 10 percentage points higher in free and reduced lunch than the next school down. And there is a great deal of distrust of the system among those households. So having on-site supports is really critical to successful outcomes around health and mental health. A great deal of fear because so many of the families are undocumented, a lot of trauma and reunification issues. And so the need for supports that are very meet families where they are and include the parents and are language sensitive is really important. And last thing I'll say is on different years, we would have more or less of that staff. And I'm sure it's no surprise, but when you start dividing up a school counselor or a social worker or a mental health person across 2 and 3 schools, the teachers and the parents don't avail them. They don't reach out to them because it's too hard to track them. And there's no momentum. So when a crisis comes up, but it's not the day of the week or even the week that mental health person is there or that social worker is there, the crisis comes and goes and you just can't get any traction. So, and the teachers all really reported that. They really partnered with our mental health therapist, which is from DHS in Carlin Springs, as well as the counselors and the social workers, even a psychologist at one point. They partnered with them really closely, and it took the burden off them as teachers to try to deal with some of these issues. So.
A lot of folks are being very quiet, so I'm looking around to the faces I can see. Anybody want to put your hand up? And Laura.
Hi. Yes, everything that you said is true. We do need to have, more social workers in particular. COVID has made it very obvious that the needs in our community are great. So the families that are marginalized, or they're unemployed or because of health issues, they have really experienced lack of everything. And our social workers have been out in the streets helping out. And, we hear from everybody that they have done a wonderful job, but obviously there's not enough of them. But one of the things that I have always mentioned is that, like, Anne was saying, we need bilingual psychologists and bilingual social workers. And the reason for that is because, if language is an issue, they're going to relate much better to someone that can communicate in their native language than it is to someone that's speaking in English. It's just, human nature. And so I don't know if this is possible or not. I have mentioned a couple of times that we have lost out when we're interviewing for staff that is bilingual to other counties because their starting salary was higher. And so my suggestion would be, can we not propose like a stipend or some kind of an edge so that when we're interviewing bilingual social workers, psychologists, even counselors, that extra, even if it's a lot of money, but, it is an incentive for people to sign up with us. And I think that as we, spend more time, money and, with interpreters and translations, I think investing in bilingual staff would pay us off. Sorry, I'm losing my voice. Thank you.
No worries.
So
Yeah,
I typed in something in the chat just to support what Laura was saying. We've heard from our students that our students specifically have said they want teachers and staff that reflect the student body. That if it's a student of color, they want to be able to talk to somebody of color who has some shared experience. And then I wrote down language pay for bilingual counselors. That's just so I can keep track of the things that we're talking about as an idea.
Sure. And I'm taking notes too. Sorry, I'm going to share this with the back in the next week. I'll put these notes together. One other question I had. So I'm assuming that you're getting your trend data from the surveys that high school and middle schoolers self-report. Is that correct, or are you getting the data from somewhere else?
No, those surveys started in 1999 or 2001, and we were the partnership is the group that helps push that data out into the community. So we have a data specialist who's an APS employee who works very closely with the schools to administer those surveys. And so the trend data really comes from the CDC Youth Risk Behavior Survey. Then we also have, we used to do something called the Developmental Asset Survey. And now we have a lot of those questions have been morphed. So they're not easily trend, but you can look at some similarities now to the Your Voice Matters survey.
And Your Voice Matters was rolled out to 4th and 5th graders like in the past couple of years, is that right?
2018, and then we do that every other year. So that was done in 2018 and then again in 2020, and then it'll be the spring of 2022 that will be the next one.
Just in terms of COVID and the pandemic, is there any sort of interest in providing that survey in the interim years too, just to get a sense of what people are really needing in terms of mental health support?
Yes, I'm saying yes. Anybody else disagree? Yes, I see.
It is needed because I think that there is no question that our students are not isolated from what is happening in our community, in our nation. COVID has hit us hard, and because of the social distancing, it is affecting, the mental health and social well-being of everyone. And Jamie is here, but Jamie Prehas. She shared with us that, the stress from caregivers is even higher, or at least that's what she's experiencing. And so we're knowing that it's not just our students, but their students are at home and are isolated, and their caregivers are stressed and anxious. So I think that overall our community is really being affected by the pandemic. And I think that we need to take that global view that we need to provide services for everybody, because if a caregiver is not doing well and is stressed out, definitely the members of their families are going to feel that as well. And so we need to take that into account.
Does the county do anything to survey caretakers?
No, not in the same way that schools do. So the caretakers of the school, Your Voice Matters, has a parent/guardian. Folks are the ones who take care of, who take that survey. The county does some surveys, but it's more a global customer satisfaction survey. Tabitha, are you aware of any other survey that gets to parents in the community that the county does? I can't think of any.
No.
I'll
After services, we often survey for a variety of different services, but not one.
And the information that I provided around parents being stressed out is based on the calls that we get to our intake and referral line with parents, with families calling in, sometimes, many times about their kids, but also expressing feeling stress around managing kids being at home, like, what to do with them, how to keep a schedule, working from home, that type of thing. And so we have started some parent support groups, and we have different topics. Right now they are in English, and we are looking to start one in Spanish as well. And then we have Flip It, which is a parent education program that we've already done one round, and we just started a second. We're just started a second round in Spanish speaking, and we're starting a second round in English as well.
That's wonderful. Well, I don't want to take too much of your time, and I have to jet off. I was telling Kim I'm a trial attorney by day and actually taking some continuing legal education. So
thank you so much for your time. And if we'll probably have other questions, I'll try to capture them, and then we can have further conversation. But as we are developing our advocacy plan, we look forward to working with you and hearing more about what's going on with the school. So
yeah, and I really appreciate all the questions and the information you provided to me, because obviously we're all learning from one another. So this really helps me sort of keep this front and center as we move into the budget season. But please don't let this be the end of our conversation. So reach out through Kim if you need my contact information, and distribute my contact information widely. Thank you, Kim.
All right. Thanks so much, Dee Dee. Have a good night.
Bye.
Thank you.
You too.
Cristina has been able to join us, and she is our new school board liaison. I'm so glad that you're able to be here with us this evening, and I wanted to give you a few minutes to be able to share a little bit about yourself and what you hope to achieve and how we can support you, because we are an amazing group of people from around the county. So we've got designated folks here from DHS, from Child and Family Services, from Public Health, from libraries, from Parks and Recreation. And then we have an amazing group of community members. And then we also have some school staff represented. So it's a great group of folks, and I will now turn it over to you. Thanks for joining us.
Well, thank you for having me. I'm so excited to officially step in as your liaison. It feels like a year ago when I came to join you all last month. It was last year, but it feels like it's actually been a full calendar year since then. But I am really, this is just certainly one of the committees that I've been most excited to join, just because of the diversity of perspectives and the intense focus on the needs of children, youth, and families. And when I think of committees that really see kids and their families from all angles, you all as a collective really represent that. And so I'm very excited to join. For those of you who have not had the privilege of meeting, and I'm person, I'm Cristina. I am officially your new school board member as of January 1st, and have been drinking from the fire hose for the past month as we're getting on board. But I'm really excited to dig into the work. As my professional background, I used to be a teacher in Las Vegas, Nevada. And I was a preschool teacher in New York City as well. And now I work for an education consulting company as my day job. And that was what I was, the crisis that I was triaging just now, or before I hopped on here. But I am really excited to be serving my community in this new capacity. Kim asked me to talk about what my vision is and what are the things that I'll be advocating for. And it actually really resonates with the conversation that we just had. We know that COVID is affecting all of our students, but it's affecting certain people in different ways. People have used the metaphor of we're all in the same storm, but some of us have a boat and some of us are in a canoe and some of us are just kind of floating by ourselves and don't even have a life vest. And I think that that's probably the best way of describing it. But to some extent, we're also in different storms. People are experiencing different layers of this crisis in different ways. Some are experiencing just the medical impact of it, and others are experiencing that plus job loss, plus existing economic uncertainty, plus existing health crisis. I love how Givenchy's glasses are now being stolen. This is delightful. This is only marginally distracting, but in a good way. And so I think of where we need to be 3 to 4 to 5 to 20 years from now. We need to really build a system that's going to help all of our kids recover from wherever they're dealing with right now and whatever they were dealing with before and whatever it is that they will deal with going forward. And I say this as one board member, I am just one of 5, but when I'm looking at our budget, I'm really looking to address the gaps and the inequities that we were seeing in the past. I think that under Superintendent Duran, we have a renewed focus on ensuring that we're starting with a fresh slate, really interrogating what it is that we were spending money on and focusing on the things that impact student learning and student well-being the most. And so I think we have a real critical opportunity here. That being said, the money is going to be short and we're not going to be able to do everything all at once. So we're going to need to get creative. And I'm really looking forward to partnering with all of you to figure out where we can focus our efforts on the most important things and make sure that we're triaging and doing the best with what we can and be creative with what we can. As far as how you all can help me, I just really want to be a sounding board. I want to hear the stories, the good, the bad, the ugly, because I cannot do my best work as your advocate on the board and as one of 5 advocates on the board unless I'm hearing what's actually happening. So I'll put my phone number in the chat, but please do not hesitate to ever give me a call, send me an email, send me a text message. I do work from 9 to 5, but in the evenings I'm generally available as well as on weekends. And I'm always happy to schedule some time to hear a story, have a conversation about a problem solve about something, ideate about a new solution, come up with a creative idea. That's the stuff that really gets me going. And that keeps me excited and jazzed about the work and the potential that we have for really building an equitable community here in Arlington. And I'd love to partner with all of you in that. So I don't want to speak too much. I do not need to be talking forever. So I don't know, Kim, if you want to do some questions or if you want to do the agenda, whatever we'd like to do.
Look around the room and see if we have some questions. I would say welcome. We're really happy to have you here, and it will be helpful for us that you have that budget advisory background that Dee Dee was talking about, because that is helpful for us to know. I mean, we want, more psychologists, more social workers, more counselors, more substance abuse counselors. We want those folks, but we also realize that there is a little bit of a structure that we have to work within. So we appreciate you. I was trying to, make more time for people to get ready to raise their hands. You've been a teacher. I'm not really good at the wait time, so I try.
And it's okay. I'm very reachable. Feel free to shoot me an email. Feel free to send me a text. I'll put my number in the chat after I finish speaking, but I'm always going to be around. So do not ever hesitate to reach out. And in the after times, it'll be nice. We can go and get a cup of coffee or go to a park and actually see each other in person once it is safe to do so, not just yet.
Yes, thank you. Well, the other things that we're going to be talking about tonight is mental health and wellness, and also the role of advocacy. And then we'll also have a little bit of a COVID update. So if you're able to stay, you're welcome to stay. I will, unless we have some final thoughts, comments. Lynn, you?
It looks like David had his hand raised.
Oh, David.
Well, I was just going to say for Cristina, you know, you lived in New York City and other places, and I've been in Arlington here for 35 years, and seems like we've never had a problem gathering volunteers to do stuff. And I wonder if under the circumstances that we're in right now, certainly by September, I would think you could, not you personally, but we could work up a core of volunteers to cover certain jobs in the schools, like cafeteria monitors, hall monitors, things that we might be able to provide some relief for the teachers and others. I mean, I work with budgets too, and what a problem it is going to be this year. And the folks that are going to be impacted are the ones that are going to be subject to the biggest problems too.
Yeah, I agree. And I appreciate the offer for help. I think that we have not, as a school system, had a really systematic way of approaching volunteers. It's been done at the school by school basis in the past. And so I think that there are a lot of, I'm also the liaison, one of the schools that I'm liaison to is Claremont, and they have a weekly food pantry that's every Monday, and they're always desperate for volunteers to help set up the bags and distribute the bags and things like that. So we have these one-off opportunities. I do think, to your point, we're going to have to think about how we do that a little bit more systematically and a little bit more coherently. And I think that there's a really great opportunity this year to rethink those ideas.
So there's
in the meantime,
go ahead.
Oh.
I was going to say
in the meantime,
there's a really good example
go ahead, Kim.
of CERT volunteers in Arlington. So the volunteer, there's an example of how it works that we might be able to share with schools. So that's all.
Yeah, I'm certainly, and I think that there's an opportunity here with new leadership, with the current crisis that we're in, to really and mesh our systems a little bit more coherently. We also have 2 board members, so I think that there's a lot of interest in being creative right now. In the interim, there's still a need, and so I encourage all of you and to encourage others to always reach out to the schools that are in your neighborhood, that are closest to you, that are communities that you care about, and just ask. Because I know that there are principals that I speak to every single day that are like, I have all of these things that need to get done. And just if you ask, then they will probably have at least a couple of things that you can help them out with in the interim. We'll certainly be thinking about the systematic level, but for now, I think that's a good stopgap measure.
Well, I will mention the group of volunteers that is incredible, and we couldn't survive without them, and that's the Medical Reserve Corps.
Oh, yeah, for sure.
Because we couldn't run our clinics. It's just incredible. So, you know, that could serve as a model as well. Just having somebody who's responsible for the Medical Reserve Corps makes all the difference in the world. And then we have requirements for the volunteers, training they have to go through. So I just wanted to put that out there because we've got a wonderful Medical Reserve Corps in Arlington.
Great case study. Great cases of an example that we can potentially continue to implement.
Anne-Marie, did you want to say a quick something about the Arlington Living Schoolyard Initiative that you put in the chat?
Hi, sorry. I walked away for a second.
That's okay.
What was your question?
Oh, did you want to say something about what you put in the chat?
Sure. So the Arlington Living Schoolyard Initiative was something that was going on pre-COVID and continued throughout COVID. And we're trying to organize with other community members to look at mostly Title I schools first, actually only, that's so far. We're looking into Kenmore, we're looking into Barcroft, and we're trying to build their outdoor spaces for learning and eating and just best practices for, we talked about like recovering, and nature is a huge part. I work, I'm an outdoor classroom educator, and it's very healing. There's forest bathing now, there, you know, all that kind of thing. So to make that accessible, especially as life has become more indoors and online for kids who live in a city. So there's some really exciting things going on, and we're tapping into national and even international initiatives, following best practices where health is concerned. So we're really excited. If you get a chance to just even listen to Alonzo Abrigado speak for the first 10 minutes of that webinar, that'd be great. And if, you know, it just shows a little bit about what's happening.
Sounds good. And this is in the link that you put in the chat?
Yes.
Yes.
Perfect. I'll add that to my reading list for sure. Thank you.
I'll send you an individual email too.
That'll be helpful.
Thanks.
All right. Any other final thoughts for Cristina? All right. Then we will move on. The next thing on the agenda is to talk about mental health and wellness and advocacy and support. And there's the Youth Mental Health and Wellness Committee has been working very hard on an amazing resource guide, and we've been having lots of conversations about updating the website and looking at data. And Kim DeBlanc and Alicia Guajardo are the co-chairs, and they've been interviewing and doing empathetic interviews really with a lot of different folks in the community. So I'm going to turn it over to Alicia or Kim. Do you want to kick us off? Everybody's on mute.
I guess I can. Yeah, so we had a great meeting this week where we're wrapping up at least the first version of a pretty comprehensive mental health guide that captures a number of resources that we see community members referring others to. That includes all of the partners here with us tonight, as well as other groups. And so those interviews are very helpful in helping us identify what kinds of resources people are looking for. We are reminding folks of our data, which shows where there are some great disparities, particularly among genders and ethnic and racial groups. So we really want to be able to make sure that any references we provide speak to those folks and are of use to them. And so it's not like some of the very comprehensive directories we've seen in other counties where you can go to a database and look up you know, whether people take Medicare insurance and that sort of thing, but it does have at least some initial information that goes beyond some of the 4 or 5 numbers that are often referred to in flyers and that sort of thing. And we hope that community members will give us feedback on this. So when we post it on the partnership website, and thanks Sally in advance for your help with that, we want to be sure to have a form to include feedback, whether there are any errors or if there are additional resources we can provide, we want to include that. Alicia, do you want to add anything to that description? We want to have this posted by February 1st on the website.
Yeah, I think that's, you did a great job, Kim, of explaining it. It has been something that's been in the works for quite some time with some pauses along the way. So we're really, you know, excited and grateful that we've got it to this point. And Kim and Judy also did a lot of work, particularly with those with the interviews of a lot of our partners. So that'll be something that we'll continue to do. I mean, we're not finished with that yet. As we share, you know, this first version of the resources, both, you know, as Kim mentioned, it'll be online on the website, but there'll also be a PDF of that. And, you know, we'll continue to look at, and as Kim mentioned, you know, really ask for feedback, updates, you know, certainly if there are some errors or something like that. So we're putting in a process in place for that type of thing as well.
The other thing I'll just mention about it is that it is going to be online. And so the beauty of not having it being a printed document that we're publishing, but that it will be online, is that we are going to have a button that says, you know, make suggestions here, because I know that we have forgotten some things. And I know that some folks who are on this call have been able to look at it and make additional suggestions of, did you think about this? Did you think about this? And so it's nice that we'll be able to add as we go along. So for example, the Career Center had a listing of a lot of different things. And so we can look at that and see, what are we missing? What needs to be added? But we also know that Child and Family Services, some of our staff know about a much larger array of services, so we can add those in. So I think that's the nice thing about having it be on a platform like a website, although we do recognize that not everybody has access to the website. So we, one of the other groups that we were thinking about reaching out to was the librarians, so that when folks go into the library and are looking up references, if the librarians are familiar with this, maybe they can help point people to this resource guide. But also making sure that staff and providers and teachers and others have the opportunity to know about it, so they can also share the information. So I'll be sharing that with everybody as we are putting it onto the website and making it look pretty. And it will probably be an internal link that everybody will have access to, but might not be something that is widely broadcast until we have more eyes. Particularly, we work very closely with Kurt Larrick, who's our public image person in the county, to be able to have him look at it with fresh eyes, and maybe reach out to somebody on the schools shop side in their public relations to look at it and make sure that we've got the public image professionals really looking at it and making sure that we're hitting everything the way we need to.
Kim, I was just going to say, we talked about, Kim DeBlau mentioned the interviews that we had done, and Alicia mentioned it too. And that was really helpful. We didn't want to just pull information together, but to go, before we actually put together a guide for a final copy, or this copy right now, this version, we wanted to go to places like residential services staff at AHC and APA, and groups that are with students and with parents, and find out what kind of questions they're getting, where, and when they try to help them, where are the gaps, and what information would they need in this guide to help them, direct them to the services and the help that they're looking for. So that, you know, more of that kind of information from others who look at the guide as it, you know, when it's put online, will be very helpful, because we know that that's going to be a large group of people out there in the community who are going to be getting this information to community members.
So overall, though, just thinking about advocacy and mental health and knowing what our data has shown us, and are there other things that folks want to talk about with regards to mental health and advocacy and our work and our role in that? Gosh, I was doing really good on the wait time too.
Well, I mean, working with schools, you know, with the counselors and the psychs and the social workers, and hearing what they need, and working with NAMI and hearing, you know, what are they hearing, what needs are they hearing from the parents who come to their I don't know what they call them. It's not workshops.
Support groups.
Support groups, that's it. But that will be really helpful to know, to work with a few more groups like that, schools and county and nonprofits, to make this as useful as possible and to share.
If I may, this is just, I'm curious. In talking to DHS, because we've been trying to communicate and collaborate more, as you know, it is important to have all of us be on the same page to provide services. It seems that with schools, when counselors, psychologists, or social workers refer students to DHS, there is a lot of consultation going back and forth. But it seems, and Jamie's on the call, so she might be able to provide more information. It seems that families are opting more for private or their own help than from ours or DHS. And so, you know, I'm just curious because you know, we are here to serve. We are here, you know, to hear what the needs are. But it seems that families are opting for something else. And it just makes me wonder, what is it? Is it confidentiality? What exactly is it that the services are there, but they're opting to go private? Just, you know, if somebody has any thoughts about that I would be interested in hearing more about that.
So from what we're seeing in children's behavioral health is that prior to the pandemic, we provided good therapy, case management services, and we were located in Arlington. And families found that that was a convenient location that they could get to. Now, most providers are doing telehealth services, just like we are doing telehealth services. And we're finding families who are opting to use their private insurance because they have a lesser copay, and they're receiving a similar telehealth service to what we would be providing.
Thank you. I find that very helpful because, you know, I think it is a matter of keeping it confidential as well, because when you do virtual, it is between you and the provider, right? And you don't have anybody else that is aware of what's happening. So I think that maybe that has a lot to do with the services that, you know, it's more convenient, you know, there's flexibility in the timing. You don't have to drive there. So there's a lot of benefits to the mental health.
Laura, therapy is always confidential, even when it was face-to-face. And so our staff have maintained confidentiality of children and families.
No, I understand, of course. Okay. Being in the field, we know that when the services are provided, it's confidential. But I think that parents, you know, having to talk to someone at the school and then having to be referred to something else might not like that. Not to say that once you receive the services, anybody is, you know, sharing that information.
I'm on mute. That's why I was so good about giving you all wait time. Are there any other thoughts, comments, or questions about anything with regards to how we're going to advocate around mental health? Because that is a big thing. And so I was glad that we had the time to be able to share that information with the Budget Advisory Committee. She seemed very interested in hearing some of our thoughts around that.
Kim, it's Linda. It might be useful to maybe circulate again some of the data that was collected around mental health, since, you know, our advocacy is built around data.
Okay.
And then maybe some of us might have some other suggestions down the road. but it's always nice if we're going to advocate to have some numbers behind us.
Mm-hmm.
That the school board presentation might be something easier to look at than the full data sets that's synthesized there.
And Kim has done a really great job of pulling together a series of questions that includes data, as well as questions to ask our partners, as well as just pulling out some very interesting things, so we can share that as well, because it incorporates everything into one place around mental health. So I can share that. I might have shared it with this group back in August, but I will reshare it now, because we used that document to create the school board presentation.
So I just have a request of the group. Although this is not an advocacy piece, this is definitely an ambassador of information piece that I just want to lift up, that despite the pandemic, our mobile crisis contract with CR2 has remained the same, and that there has been face-to-face contact with children and youth and families who needed it to de-escalate mental health crisis situations. That has always been there. They continue to go into homes as families will permit them to do so, and as the need indicates. The other thing that you should know is that we've expanded the age range so that young adults up to 21 can also receive those services. So when you hear of a need in the community, hopefully you can, remember CR2 is still providing a service. It is sorely underutilized. And so we would really love for you all to, keep that in mind, that they are available and they can feel a need right now.
Tabitha, can I ask, if it's underutilized, have you all done outreach to some of the residential places like AHC and APA and other places to let the staff people know or the families know that these services are available?
We've done lots of outreach. We'll continue to do so. CR2 does their own set of research, outreach. They've actually reached out to all the local colleges as they expanded the age range. We're trying to, capture those folks as well. They have a PSA info blast. Like, we will continue to send all of those things out.
I have a question for Laura and I guess Jamie and Tabitha. Do you keep data? You must data on the number of phone calls that come in asking for help, a number of visits and all that kind of thing. And Laura, like with psychologists and social workers or counselors, how many parents or kids contacts are they getting? And can we show, is there a way of having some sort of an update on since, in the last year or something, our community has seen this kind of increase in contacts with our mental health staff in the county and in our schools? Because that's going to be helpful when we're looking for that kind of thing. Yes, we have the other data, but to have that and say, right now, here's what's going on.
Jamie Premdas is the contract manager, for example, for the mobile crisis response. We meet with them weekly and we go through our data. The issue is that it is an underutilized resource. Children have not been coming to the attention of mental health services until the acuity is so high. Some of these families don't want people in their homes because of COVID, which is understandable. So there's a variety of different reasons why people may, and many families have their own private insurance. So they opt to remain with the provider that they already have a relationship with. So there are many different reasons why people may decline or think they need the service at the moment and find out how intense it is. And then like, wait, no, I'm going to stick with what I already have. But we definitely keep information. The information we have is not going to justify, anything more than what, already exists, right? Because it is an underutilized resource. So I have to be transparent and let you know that.
Thanks. So in terms of, it's not that school counselors keep track of how many, kids come to their office or call them, or they don't. But I can tell you that because of Medicaid, and we are able to get some money back from services that we provide on student related, and that would be counseling or services that we provide. There's certain information that we keep on, those cases, like, how many hours of counseling are kids receiving, and, how many hours of consultation are we provided. That information is available for social workers and psychologists. And if we see, the trends, we have seen an increase in the amount of time dedicated to providing services to families and students. And Wendy Correa is having their staff, enter that information. So it's not exactly what you're asking, because, and then somebody, I don't remember who asked us this before. It's not, or it has not been our practice to, tabulate every time you get a phone call, or every time you meet with the student, or anytime somebody asks for consultation. That has not been the practice, because the reality is that all students are going to be served one way or the other, right? And so we don't keep a tab on how many times we meet with a student or talk to somebody. But in terms of, having to provide the information for the Medicaid, we have that information, and, we can make that information available if that's helpful.
Yeah, I'm sorry.
I was just going to add that we do keep data on the number of calls we get to our referral and information line. And that could be anyone calling to schedule an appointment for same-day access. That could be someone calling to ask, what insurances we take, or they ask about, how to connect them to their own private insurance. So that could be any call that we get inquiring about services, referrals, community resources. So we do keep that data. We also keep data on how many of those calls then turn into kiddos that are admitted for services. And then, like Tabitha said, we have data. CR2 is a regional contract, and so we meet with them weekly, and then we have the data on the region's use of CR2 as well as Arlington's use of CR2.
And I see you have your hand up.
Just a quick clarification, Tabitha and Jamie, when you say people have private insurance, you mean non-Medicaid? So I would think that the Medicaid clients, Medicaid covered clients you'd be seeing them. They wouldn't necessarily have providers in the community that take Medicaid. Is that your sense?
We absolutely see families that have Medicaid, private insurance, and clients
uninsured
that are uninsured. What we are seeing, we are not seeing the number of children for services per week that we did prior to the pandemic.
Sure.
Many families are waiting. I think families are kind of waiting it out, thinking like, this will be over soon, this will be over soon, this will be over soon, right? They're going to go back to school. This is going to, and then the numbers keep rising. The vaccines aren't what we think, right? And so stress is building. And so when kids are coming in, they have much higher needs at intake than they did pre-pandemic. So many people who reach out to us are not just families that have Medicaid.
Okay, that's really helpful. Thank you.
And sometimes families that have Medicaid also they already have psychiatrists in the community, or they already have providers in the community, and they were referred to us. They call us, they check and see, what we have it might not be different than what they're already getting.
And I'm sure this is the answer to this is, of course, but you, the folks at the pediatric center know about CR2 and all of that, right?
Absolutely. Yes. But everyone can use a refresher, especially since they went up to 21. And we just want to, for everyone here to, like Tabitha said, lift up that CR2 is available, but also children's behavioral health is available. We can offer same day access appointments for intake. When someone calls, we had 2 people call yesterday who we offer to schedule to see them that day. And you know, most people don't call thinking that they're going to be seen like in an hour, right? But we can offer same day appointments, next day appointments. We are open, we're available, and we're thinking creatively to engage kids as best as possible, given the circumstances, so that they're safe and also our staff are safe.
I think we, a couple months ago, maybe in the middle of all of this, there was an email that went out that provided more of that information. I'll dig it up and resend it to everybody, because it is helpful to have that more than once every 3 months, you know, just to remind us that CR2 is an option. Same day access has expanded age ranges. So I know we've got that somewhere. So I will look for that.
You don't have to look. We can just send it to you. It's fine.
Send it.
Don't go digging.
It doesn't take any time to do that. And then Lynn suggested perhaps we have a crisis link presentation, because although we've had that to the mental health committee, I don't think we've had that, and we might not have had that to the committee in a while. So maybe that's something that we bring, since mental health really is, I don't think it's a stretch to say that is the main concern that we have right now for our youth. So I put some questions for us to consider in the chat, just so that we can think a little bit more about not just mental health advocacy, but health on any issue. We need to remember the questions that we're asking ourselves all the time. Who benefits, who's burdened, who's missing? How do we know? What additional information do we need? We're going to be talking about it more. As Linda said, I'll share the data, but we'll really look at disaggregating it so that we can address the equity across Arlington, and not just as Ann Vorderbrady suggested, 1.5 counselors go to all of the schools. And really, does that make sense when we know that there are certain schools that need additional supports? Are there any final thoughts before we move on to maybe some COVID-19 updates from Lisa?
I just want to, I think it would be helpful for future advocacy efforts for APS if that kind of data was actually tracked, so then you can know what the needs are and you're data informed rather than anecdotes. I think that gives a powerful presentation, so that you know what actually the need is.
So you're to possibly track the number of calls and how many times a particular student calls. Is that what you're saying?
Well, and what schools need the most support, and what are they saying that their needs are? How do you know in order to do the advocacy if you don't have the data? I don't really understand that.
No, that's not so. Each school has their own data, and principals are able to assess their data depending on the needs of their student population, and they create goals for their school. But that data is not shared with, so central office does not keep track of specific data at each school. So it's a lot of site management. So for example, if we're talking about number of times a counselor gets called by a parent, the counselor is not going to take the time to write down how many times a parent called me, if that's what we want to know, because
no, I'm not talking about being. I'm not talking about being scolded.
Talking to a student. So do they do surveys? They do surveys within the school, and they're able to collect data. But it is based on site management, what is needed at the school. What we're asking is, from what I understand, that we want general information from school to school that we can provide to the community. And that's more difficult because if you think about where do we want our time to be spent? It is true, I'm not saying that the data is not important, but as we are talking about not having enough staff to deal with the issues, our priority is to serve the students and to serve the families and not spend a lot of time in data collecting because that is very time consuming. So, I understand what you're saying, but it's very difficult for student services to do both. And so at this point in time,
I respect that and I understand because it's equally difficult for DHS and our clinicians to do that.
But you're making that suggestion and I'm just responding to that. That would be very difficult. I think that at some point in time, we would have to figure it out. What is the best way of collecting that? And we would have to have dedicated people, to do that. It's time consuming. I understand. I'm not saying that that's not a need. I just think that in this time and age, it's difficult just to get everything done. And we just need to think more, be practical. How are we going to move forward with this?
Megan, I see you've had your hand up.
I had the same reaction as Tabitha, and I'm not sure. It's hard without the full picture. I know it's easy to opine based on comments, and discussion in the meeting, but it sounds, Laura, as if you're saying principals do have a certain amount of information. There may be user-friendly ways to sort of track things. And I know, I've worked at a nonprofit where you had to track your hours spent on each case. It can be very time consuming, but I think there are ways to manage that, in an efficient and easier way. If there's information going to principals, is there any reason why that can't be shared system-wide? I agree that, and I don't understand the big picture because I heard Jamie say there are things that she's tracking, and that sounded very useful. And so just to do that kind of level of system-wide tracking, especially if we're asking for more resources for particular schools from an equity standpoint, I think it's challenging to say where those resources should go if the need isn't understood system-wide.
Yes. So there's so many data that schools need to collect. And I think this. There's data that we need to present to the state that is mandated. And there's data that we collect just within the schools because it's important for us to provide services. So there is data being collected. However, when we say, are you collecting data? Not every data point is being collected at each of the schools. So for example, you may ask for certain data that one school may have, because they have prioritized what is the data they need to identify at one school. But that might not be the same data that is collected in another school. So when you're trying to gather every school in all grade levels, it makes it very difficult. And so that's when we say data is collected at the school level, and the principals, are responsible for managing, their resources at the school and the time allocated for that. But I do understand that once we identify what is the data that we're looking for, perhaps it's a conversation that needs to be had at the school, that all schools need to have something. I mean, there's data that everybody have. What is the attendance? How many risk assessments do we do? How many IEP meetings have we had? And I'm just, these are just things that I'm saying on the top. So data is being collected, but it seems like people want more detailed information than that.
Thanks. It's good conversation and good to think about what's out there, what are the possibilities, and all of that information that really does go to the question of what additional information would help us in advocating and just making sure that we're looking things in a lot of different ways.
And keeping in mind from what Laura's saying, they're talking about 41 different schools with 41 different models of how they might track that information. I appreciate the suggestion, I really do, but I also, just looking at it from the APS wide perspective, it seems it's can be cumbersome.
I'm looking around the room. Any other thoughts around this? It's definitely not the end of the conversation about mental health advocacy. It's just that in the interest of time, I thought we would spend a little bit of time hearing from Lisa. I'm looking to make sure that Lisa's on the call still.
I'm still here.
There you are. Hi, how are you? Lisa is with our public health office, so school public health, and she offered to share a little bit of information about the COVID-19 update. And there might be additional information next month, but you're shaking your head. What can you share?
Oh, it just changes sometimes almost daily. And I know everybody now is focused on the vaccine, but I need to remind people that we still have a lot of new cases, which is really still disturbing. It seems to be leveling off around the country, but not quite yet in Virginia. And it's being quite scary. So we still very much have COVID with us. In terms of the vaccine, I think people know that 2 vaccines were approved for emergency use authorization in December, and we're now using them in Virginia. Until last week, the hospital was using the Pfizer vaccine, and they had vaccinated a large number of their own staff and other healthcare workers, and had moved on to vaccinating people 75 years old and older. And we in public health were focused on law enforcement, healthcare workers, and most recently, school staff. All school staff interested in being vaccinated. And, you know, both we and VHC were moving along. And then last week, things changed significantly. The governor and the Virginia Department of Health changed how they were distributing vaccine. The Pfizer vaccine requires minus 80 degrees centigrade storage, and you have to have a special freezer for that. VHC has the freezer, and the Pfizer vaccine was going selectively to health systems. And health systems were handling things, I guess, each their own way. VHC would certainly has gone beyond their own staff, and as I said, was focused on people 75 years old and above. Inova had been doing similar things. I believe Inova was focused on school staff. But with the shift in distribution of vaccine, the state is now distributing vaccine on a per capita basis, which means that Arlington is getting less vaccine than we had been getting. I believe we had been getting a little over 3,000 doses a week, and that's down to 2,000 something. And it was going to be difficult for the hospital to continue their vaccination program with the cut in vaccines. So they, at least for now, are not vaccinating people 75 and above. There's been a lot of people upset because their appointments were canceled with VHC. We're picking that up in public health, and we'll be scheduling all of the people who had appointments with VHC. It's just taking time to get all that information out, and all this just happened
like on Friday. It also means that we will have to slow down perhaps a little in terms of vaccinating school staff. We continue to do that, and that's been our focus for at least the past week and a half. On the Saturday and then the Monday of Martin Luther King holiday, we vaccinated, I'm trying to remember, it was well over 1,000 people.
I saw
Maybe
that.
800. 2,000.
Yeah.
2,000 each. We're now vaccinating about 600 people a day. And again, the appointments for people 75 and older will be rescheduled and may even start to be scheduled this weekend. I know we'll have clinic on Saturday. We were going to have it on Sunday, but we don't have enough vaccine. And now public health will be handling both the Pfizer vaccine and the Moderna vaccine. The Pfizer vaccine will have to still be stored at the hospital because we don't yet have our -80 freezer, but we will be using both vaccines. We've given some second doses of Moderna already. Both vaccines require 2 doses, Moderna 28 days apart, Pfizer 21 days apart. So we're shifting gears a little. I did just hear that there will be more vaccine going out to states, a decision of the Biden administration, which is good, but we won't know maybe till the end of this week or next week what that means in terms of the doses will be allocated. The plan is to have a stable idea of how many doses you're getting per week for at least a couple of weeks, so we can plan better. I will also say that CVS and Walgreens have been providing vaccine in long-term care facilities, mainly nursing homes to date, some assisted living, and a few independent living facilities in Virginia. And working with Maimuna on that, we hope to train additional people who could perhaps, could definitely go out to affordable housing, because we know there are going to be elderly who just aren't going to be mobile. But all this is going to be a bit on hold until we get more vaccine. So we're trying to do all that at once. We've been training vaccinators. So those 2 days where we gave 2,000 plus vaccines, we had 17 vaccinators, and it worked very well. We have had a few severe reactions just in the past week, which have been handled very, very well by our own staff and by EMS. So there's a lot happening and there's a lot shifting. And I'm well aware that there are many angry people out there. The scheduling hasn't been the smoothest. And I know school staff have not been happy about that. And there are many, many angry people over 75 out there. And we're just doing the best we can and shifting gears as much as possible. I can tell you that we couldn't have done this without the Medical Reserve Corps and without just an incredible number of people putting in time for this. It's more than just having vaccinators. We need people to register, to manage our lines, to monitor people afterwards, because we monitor people for either 15 minutes or 30 minutes after their vaccine. And as I said, we've had 3 episodes of anaphylaxis or near anaphylaxis, which can happen with both Pfizer and Moderna. We're still getting an idea on how often that happens. They say 2 per million for Moderna and 11 per million for Pfizer, but I question those numbers when we've had 3 in the past week, just us. So We're making the reports to the CDC. I have a call into them. Just a lot of things happening. Our clinic is in Sequoia 2. It's been fantastic that APS has allowed us to use the space. It's worked incredibly well. And it's a much bigger space and better space than what we were using on the ground floor of Sequoia 1. But we may use Sequoia 1 again. We'll see. The categories that we're focusing on, 1A are healthcare providers and residents and staff of long-term care facilities. 1B are people now not only over 75, but over 65, but we can't move to the 65 to 75 until we get more vaccine. Certainly school staff, law enforcement, we focused on them and we vaccinated many law enforcement folks, not only for the county, but for the feds as well. And we'll be moving to food workers, postal workers, transportation, all those included in 1B. In some ways, it's unfortunate that the governor and the administration raised people's expectations. We figured that for what's in 1A and 1B now could easily be half the population of Arlington and half the population of Virginia. And we just don't have that much vaccine. I know the Biden administration has arranged to purchase more. The other good news is that 3 other vaccines are coming up for approval, hopefully in the next month or 2. And one of those only requires 1 shot, and I'm rooting for them. It would be so much better to just give 1 injection. I'm also rooting for other vaccines because I suspect that that we'll see different rates of reaction to the vaccines. They're using different mechanisms so that people who react to the Pfizer or Moderna vaccines may well be able to get the AstraZeneca or Janssen or Novavax vaccines. But we're learning about that as well. So by the spring, we really should have a significant increase in what's available to us, both in different vaccines and the numbers that we have. So with that, I'll answer questions.
Anne has a question. So
Yeah.
how do the seniors in the affordable housing know that they should get their shots from CVS versus through the county?
Well, actually, the CVS is focused on congregate living. So they are going to nursing homes and assisted living and a few independent living sites. So those living independently in affordable housing don't have CVS or Walgreens coming to them. We're going to have to figure out a mechanism to really reach out to them. And again, we're working with Maimuna, we'll work with behavioral health. Hopefully we can train more vaccinators. And as we get more vaccine, my hope is that we can do more outreach to people who aren't mobile. The other thing that's likely to happen in the next few months is as the vaccine supply goes up, I'm really hoping that more and more pharmacies can offer the vaccine, which will make life a lot easier all around if people can just go into their CVS or their local pharmacy. The vaccine is free. We own it. The U.S. public owns this vaccine. And both the feds and the state have bent over backwards to make it possible for people to get vaccine with no out-of-pocket cost. Insurance will be charged for administration costs, but people who don't have insurance will figure out ways to get it to people for free. either through contracts with pharmacies, certainly through public health. We're not going to charge people. But there should be no reason that anybody pays an out-of-pocket fee. Now, there are concerns about acceptance of the vaccine. And I've, tried to stay in touch with Maimuna to see what's happening in Arlington. I know in many places, less than 50% of nursing home staff have chosen to get the vaccine because they don't trust it. It's been developed quickly. We have a horrible history of what's happened in the Black community. There are many in the Black community who are doing a great job reaching out to people in their community. And what I hear is happening is that many staff will not get the vaccine the first time around, but will get it after they watch others get the vaccine and find that most people do okay with it. I will tell you, though, that after the second shot of Moderna, you don't feel so good. But most of the time that goes away in a day or two.
Jamie had a question.
Yeah.
Thanks so much. This was really informative to hear all of the, we know it's complex, but to hear it all. So kudos to everyone who is working on this because you guys are doing a lot. I'm wondering if data around who is getting the vaccine is being disaggregated by race, ethnicity. I'm sure
we are
getting around age.
We are doing that, and that is the intention of the Virginia Department of Health to get those data from everywhere in Virginia. So I don't have an answer for what data we have in Arlington, but all of us are working very hard to get those data and to make sure we understand who is getting the vaccine and who is choosing to defer getting the vaccine. And I've heard, and I agree, it's better to talk about people who are, kind of thinking about it, deferring it, instead of really, people refusing the vaccine. I think the studies have now shown that there's a significant number of people who just want to wait and see, which is quite legitimate. And we're just going to keep working with everybody. As I said, it's often the second time around that CVS or Walgreens go into the nursing homes that many of the staff decide to get the vaccine after they see others get it as well. And I'll put this offer out there. I've talked to Anne's group. I talked to a group with working with aging about the vaccine. I'm willing to talk to folks to make sure people understand that these were fully tested. The technology is incredible. It's a key reason that we've gotten the vaccine so quickly, but there were no shortcuts with the clinical testing. And Pfizer and Moderna tried very, very hard to recruit Black and Latinx members to be part of the studies. And they didn't do as well as they might have, but they did a whole lot better than what has happened in the past with clinical trials. So I think we can actually tell people that these vaccines have been, the people who took part in the trials look like them. It's an important message to get across. And all the companies understand that. And that's something that we're all looking at. Not only what are the results of the trials, but who are the people who actually participated in them? And, we're doing a better job. We could do better, but it's a step in the right direction.
Thank you so much, Lisa. That's really helpful information. And I know that Ruben, Dr. Varghese, has also put together some videos and things, and I'll see if I can find some of those to share, because it's really great information, and the more we can get it out there to support what's going on in Arlington and the good things that are going on and some of the reasons why there have been some difficulties, so that again, we can support the good things and the good news, and try to make sure that everybody's got the facts about why things are going the way they are. And I've heard a lot of different misinformation and have tried to counter it. Yep.
I heard from some school staff that we were prioritizing teachers over other school staff, and that's just not the case at all. It's all school staff. And yes, we vaccinated bus drivers and custodians. So it takes some time to counter some of the information floating around out there.
So let's get the facts and share the facts whenever we're able, whether it be about mental health or about vaccinations or whatever. We want to be the fact checkers. No fake news here. Are there any final thoughts, comments, suggestions, anything that anybody wants to announce before we close out this evening's meeting? And I'll turn it over to Megan and Michael for if they want to share anything, but I'm looking to see, are there any hands up? Announcements? I shared earlier that our new person will begin. I can't say her name, but I can tell you it's a she. She needs to be officially appointed by the school board at their next meeting. So Cristina will have a chance to announce her, and then she will start the following Monday. And so I look forward to being able to introduce you all to her in person, and she's got a lot of work ahead of her. That's my announcement. Megan, I'm turning it over to you.
Hi there, and I see Michael is here, so I'll let him have the last word if there are no other questions. But this has been a really rich meeting, really informative, great discussion. Nice to see faces. I know I've been in and out. Mostly it's just to not eat on camera. So I assume at this hour, there might be a few other people who are the same, but thanks as always to Kim for putting together a really detailed, clear agenda, great links. To our guest, to Cristina, welcome, to others for the discussion. Deirdre, so impressive. I'm sorry she has a day job, but it sounds like she's doesn't skimp on her advocacy for APS, and I hope people will keep thinking about budget ideas. Cristina, did you have anything you wanted to add before we wrap? All right. Well, thank you, everybody.
All right, Michael, you want to say goodnight? Okay, then good night to everybody. Cheers, mask up, keep everything that Lisa said in mind, and we'll celebrate the vaccinations, and maybe we'll have a big picnic in the summertime. Cheers, have a good night, take care.
Thank you, Kim, great job.
Good night.
Good night.
Good night.
Good to see you. Everybody. Nice to see you, Kim, take care. Good night, Anne Marie. Thank you so much, Jamie, for everything. See you, Sally. I'm ending the meeting.
Good night. Okay, good night. Sorry, I was trying to.
Good night, guys. Thank you.